So with startups, timing isn't everything, but it is a really big part of the equation. And NarrativeDx is a company that came to us from Austin, Texas, with some early signs that they were onto something. And over the last several weeks, through a lot of hard work, they've proven that they really are onto something over and over again. And they're also showing how much the complex enterprise sale, even in a healthcare setting, which is notoriously long sales cycles, can be compressed when you have the right people, the right product at the right time. So please welcome NarrativeDx.
Good morning. I am Senem Güney, co-founder and CEO of NarrativeDx. It's a brave new world out there for healthcare. All of a sudden, hospitals realize they need to do what other businesses have been doing forever: pay attention to what their customers actually say about them. Unhappy patients have become very, very expensive for hospitals. On average, $6 million a year per facility is at risk for mid to large hospitals due to regulatory changes. Now, how much of this money they can recoup or lose is based on scores they get from government-mandated patient satisfaction surveys. If these scores don't improve, millions may flood out the door. Now, this has become such an urgent problem that a new C-level position has been created in most leading hospitals: the Chief Patient Experience Officer. Hospitals have created this position, but the person in charge does not have the necessary tools to do the job. Currently, the primary tools that Chief Patient Experience Officers rely on are surveys. And from these surveys, hospitals receive scores like 60% of the time patients feel nurses don't listen. And the histograms of quantitative data from these surveys do not help explain the patient experience context that these professionals need to understand to improve. And there is no one-size-fits-all solution to this problem, especially because of the fact that these days patients talk about their experiences across a variety of very distinct platforms. Patients talk about their experiences in focus groups. They talk about them in the comment sections of these government-mandated surveys, and they talk about their experiences in social media publicly. Now, how can a Chief Patient Experience Officer learn from patients' experiences without having to read tens of thousands of lines of unstructured feedback? This is the big data problem of patient experience, and we are here to help. NarrativeDx collects and analyzes unstructured patient feedback so hospitals can improve care and maximize their reimbursements. We help you make sense of and learn from what your patients are saying about their care experiences wherever they say it. We identify patterns and detect signals that otherwise be buried in the noise. We then use these patterns to extract actionable insights and help hospitals target their improvement efforts. Now, let me show you how this works in practice. Our pilot client in upstate New York had persistently low scores in nurse listening. And the only type of data they had for review and for action were histograms of quantitative data from surveys. The numbers were bad. They looked at the numbers, and they did what most hospitals with bad patient satisfaction scores do. They hired a very expensive best practices consultancy. Consultancy came in, told the nurses to smile at the patients and to be polite with them. The needle did not move in the right direction. What they were missing was what patients were saying in their own words. They lacked the ability to drill down into the context behind the scores. That's where we came in. With our approach, we were able to show this hospital that on cold nights, they ran out of blankets. And when nurses didn't provide blankets, weren't able to provide blankets, patients felt ignored. Now, since there is no way to reflect, no box to check for this kind of experience on these surveys, this experience got reflected as poor listening scores for nurses. And these poor scores were costing the hospital significant amounts of reimbursement dollars. Our software-as-a-service solution provides the context behind the bare-bones survey scores. Now, surveys alone, by themselves, show you what patients marked on a scale. We show who did what to cause these scores, show you the root causes behind the scores, and help the hospitals see the reason why behind the scores. Now, if you can see common themes such as cold nights, chilly nights, uncomfortable room temperature, no blankets, coming out as common themes from comments that relate to a specific score, like this, a bad score about nurse listening. And also, if you can see the sentiments identified in these comments and the staff members commonly mentioned, you know exactly why you're getting the score you're getting, and you know what to do immediately. For our pilot client, it was buying more blankets. They bought more blankets, the nurse listening scores went up, and now, instead of being penalized, they're getting bonuses for their reimbursements. Forward-thinking institutions such as NYU Medical Center, one of our paid implementations, an institution for one of our paid implementations, love what we help them accomplish. They love it so much that they've been referring us to other leading institutions in the country. The results of these referrals and our own outreach efforts have been quite striking. Just in the last 4 months since we joined DreamIt, we have had conversations with 50 hospitals. We have 3 paid implementations, and now we are negotiating contracts with 15 of these institutions. I have developed the concept of NarrativeDx during my dissertation research and as a process consultant at IBM. I worked on this concept, which is the roots of organization level, high-level phenomena in themes of talk for the past 15 years in academia and in the industry. My co-founder, Kyle Robertson, who is a computer scientist, an intellectual property attorney, and an entrepreneur with a successful exit, joined NarrativeDx to build this concept into our product. Currently, we are raising a seed round of $500,000. And the objective of this round is to expand the team to go live at 50 institutions by the fourth quarter of 2015. Currently, at our early adopter rate, our pipeline is at a value of about $750,000. So the time to scale our business is real, is now, because the demand for our product is real. We are seeing it every day. The demand is real because the regulatory changes made unhappy patients very, very expensive. And hospitals responded by creating this position, the Chief Patient Experience Officer. But this person in charge of solving this problem does not have the tools necessary to do their job effectively. We have developed this solution that Chief Experience Officers need, and our rate limiter is capital. If you're as excited as what we're doing in this space, we'd love to talk with you more about how you can help us become the leading solution that will shape the future of patient experience. Thank you.